Hi, everybody. It's DocTalk, and top of the day to all of you, top of the morning, depending on where you are. It's St. Patrick's Day, 2023, and we're doing another issue of DocTalk, which this week will be your talk, because I've had a lot of questions this week, very interesting ones. I'm in a hotel room at a conference talking about community paramedicine and mobile integrated healthcare, which is a very timely area of development within public safety. A lot of talk between all of the public safety agencies about what we can be doing better to serve our communities. And one of the places is to take care of people who are our most frequent utilizers of services, and what we can do better to reach out with the healthcare system into the communities at a point where everybody just loves that idea. So it's coming into spring. That gets here officially next week. Temperatures staying cold across a lot of the country, and I was in snow last week, and we had an icy day on the roads. So Mother Nature is taking a look at the country this year and saying, let's delay spring a little bit, I think. But it is time for us to focus on what's coming ahead in terms of good weather and our ability to work with each other. So your discussions this week, a lot of people have been talking about the wind down of COVID, and that's in fact really happening across the country. The numbers are at all-time lows. People who are getting sick oftentimes aren't reporting it at this point because their illnesses are relatively minor. That's a good thing. We have the lowest load of COVID patients in hospitals that we've had in ages. You are still at risk if you haven't been vaccinated, haven't been ill. You kind of escaped through the last 3 years. We're 3 years now, as of this month, into this. And some people got through it, and when they get COVID, they can still get very sick if they haven't been vaccinated. Big news this week that was a question about the vaccinations into the fall. And an announcement was made at the FDA level this week that said they are not going to be able to offer a combination COVID influenza vaccine for this fall. That was something I told you about to be aware of, but they have officially said they're going to focus on the right thing to do for each of the two disease paths, and it still may be that we'll get 2 jabs this fall. So plan for that October, November, early December in your health planning for your agencies or for yourself, but it does not look like we'll have a combo vaccine into the fall. This week, also, the FDA notified us that the bivalent vaccines are approved all the way down to 6 months of age. So for those of you with children and planning ahead for that, the bivalent vaccines approved down to 6 months of age, with, again, a high effectiveness rate. Our vaccine effectiveness across the globe has been proving to be real. And reduction of the level of illness. If you think about where we were 3 years ago, we were just going into quarantine. We were locking down so many things and saying when the vaccine gets here, that's when we all get out of jail. And that December was the first release of the vaccine. Many of you got your immunizations in January, February. So we're now 2 years into vaccine program. It has been effective. We've changed what we've done in terms of delivering the vaccines. We think we still need a regular interval of the COVID vaccination. There's not going to be a 1 jab and you're done, or a 2 jab and you're done kind of a thing, just like with flu. And so your discussions with me about the vaccination and the plans for it are, we're still going to need regular vaccines. They're going to be tweaked each year based on the variants. There was a question that came this week about what's happening in China, and the word from China is still good word in terms of the globe. Okay, we were worried about China and that new variants could come up that would threaten the rest of the planet. Those have not occurred. with very rigid surveillance done by the Chinese. Now they're not releasing the results of their surveillance, which is what the Chinese do. But they are so concerned that this will wipe out many more millions of their people and create instability in their society. They have been looking very hard for variants of coronavirus, and they have not found them. So that's really good news for all of us. That means no big changes in what we have to do vaccination-wise, and that means there's less risk of more dangerous variants appearing across the globe at any point moving into the future. So that's where we are. What is occurring in the country? That was another question, and it is GI illnesses. And I was the benefactor of a gift from one of my grandkids this week. It is still no fun to have the vomiting diarrhea combination, and it was a miserable experience, as it would have been the past 3 years. Our general keeping away from each other has kept GI illnesses at a low level, but the lowly cruise ship virus, the norovirus, has been spreading very readily through the population, and that was no doubt what was being spread in the schools and the daycares. And one of the grandkids was nice enough to share it with me, and it's still not a fun experience at all. Another question: as we move into the spring and good weather, what preparation should we make? It's staying cold does not allow your body to acclimate. Very important word, acclimate. As we move between the seasons, your body really does significantly change. And you can look at something as simple as your hands. And in the fall, your hands set up for the winter time, they generally dry out very intensely, and you begin to, get these terrible cracking lesions. And my fingertips begin to crack in the fall, and have to apply stronger and stronger creams and lotions to keep them. So that's the wintertime acclimation as we get into cold weather times. As we move into summertime, your body says, oh, longer days, warmer temperatures, I'm going to keep more water aboard. So this is naturally the time of the year when your weight goes up, because you are acclimating by keeping more fluid aboard. And where you don't have time to do that, you are at risk for hypovolemia. So I live in Florida. We have people coming down at a pretty high rate to do their spring break stuff. And those people are coming down from cold temperatures where their kidneys have been squeezing out all of the extra fluid that you don't need in cold weather times. They come to Florida and they can't acclimate fast enough to really nice hot temperatures and a very bright sun. And they get hypovolemic. And for the most part, that means they get weak and dizzy and pass out. And they're very sensitive to the hot weather, and they feel crummy, and it ruins their vacation. That's a really important part of it. So you can attempt to fool your body as you're moving into warmer times by drinking more fluids, by eating regularly, which is another important part of keeping fluids in your body, is to have some calories in there that hold them in, if you will. And sometimes that works well, and sometimes you just can't do it fast enough. What it means for all of you in the fire and EMS service is when you go from cold weather to a really hot day and have working incidents, that is the time when you are really depleting yourself very quickly. And you are at risk for a couple things. Number one, the weak and dizzy and passing out stuff. But number two, you get clumsy and you trip over a hose, or you trip, going up and down the steps and stuff. And so I want you to be aware and very conscious of the fact that when temperatures change very rapidly, going to warmer temps, you got to try your best to stay hydrated, to plan ahead. If you're an officer, this means bringing in extra companies, and it means focusing on rehab as part of that operation, especially if your incident occurs early in the day. So you've had cold weather, come into shift. It's a warm day. It's morning time, and you get a working incident. And your crews are out working hard. It's early in the day. They still got to get through a 24 at least. and they're working hard, and you're like, oh, they'll be fine. Everybody's happy that it's a warm day. It is bring in extra companies, do extra rehab, because they are going to feel lousy the rest of their shift. If they work hard, they're not acclimated yet. They've been in a hot climate. They made it through that incident. Now they got to find a way to get their reserves pumped up for the rest of the shift. And that tripping over the hose, falling down the steps kind of thing is a risk for the rest of that shift. And so this is the time of year when you really got to focus as a frontline officer on the health of your company. And particularly if you have working incidents, got to be really careful, do extra rehab, plan for extra fluids and calories to be at the scene, plan for extra companies working so that everybody gets a little bit of work in, but nobody gets too much work in. And that's an important part of this time of the year. Another question this week is about skin health, and those people coming to Florida, a lot of them leave as little tomatoes because they get so much sunshine, and again, 3 years of kind of staying in the shade, et cetera. We have a lot of people who are getting sunburned beyond the usual. That is still very unhealthy. It's unhealthy for a short time in an uncomfortable disease. It's unhealthy in the long term because that's skin cancer risks. And so it's really important if you're going to be outside, and even for us working in fire and EMS and law enforcement, you got to carry some sunblock with you and use that sunblock regularly. That is really the timely issues that are going on now as we're moving into times where really you're looking at concerts and get-togethers and family reunions being planned and other things. We have some really fun times ahead. And if you think back to how it looked 3 years ago in March, we didn't know when we were going to be able to get back together. We didn't know when we could enjoy going shopping, going to church, going to concerts, being together at a birthday party and all that. We've been through a lot in 3 years. I want to congratulate you on making it through 3 years. Once you know it's good to get back together again. And we're making it through many of the things that we had the deficit of. So that was all those respiratory infections we talked about in RSV and flu, and now the GI stuff. And we're going to make it through all of that. And we're going to get into the summertime where we're really enjoying the things that we love to do together in a new way. And so I wish you all the best as we move into springtime, and please make plans to be together, to enjoy your time together, to be able to teach together. For many of us in public safety, we haven't been in the schools and doing our usual public education stuff we love to do, and you're going to be doing that again. So welcome to springtime. It's another Doc Talk. Enjoy St. Patrick's Day, and into the spring we go. Thanks, everybody.